At the 2015 Conference on Retroviruses and Opportunistic Infections, Dr. Ronald Valdiserri spoke with Dr. Gina Brown from the National Institutes of Health.
Hello, this is Dr. Ron Valdiserri reporting from the 2015 CROI meeting, and I'm delighted to be joined by my friend and colleague, Dr. Gina Brown from the National Institutes of Health. Gina is an advocate for women's health, particularly in terms of HIV prevention and care. Gina, what would you like to share with our viewers about what we're hearing at CROI about advances in women's health as it relates to HIV?
So I think this CROI in particular has quite a bit about how much we can learn about what's happening with women. And I think the issues of the National HIV/AIDS strategy have really pushed us to develop some data and some information that will help us better understand the issues of women. In particular, there was a CDC presentation that talked about women in the care continuum, and what it showed is that although 83% of women end up being linked to care within the 3-month period, as you look at it over time, women start to fall off. And so that if you're looking at women who are maintained in care and a suppressed viral load, you're looking at levels in that 40 to 50% range. And it's interesting because it's the younger age women, as you'd expect, who don't manage to stay in care, but also don't manage to maintain a suppressed viral load. And then a really sort of rocky look at the women over age 55, where it's very much in the ups and downs. So I think it's helping us both better understand women, but also confirm what we know, that it's really hard to get these younger age groups not just into care, but to keep them in care and keep them healthy.
So I think one of the major take-homes at a high level is that we need to continue to invest in research about better ways to keep women healthy. And having said that, I'm sure that some of our viewers have heard the results from the study in South Africa related to the prevention gel. Do you want to just share with viewers what we heard at the CROI meeting and what it means in terms of HIV prevention for women?
So you're talking about FACTS 001. It's the follow-on consortium for tenofovir studies, follow-on African consortium for tenofovir studies, and it was doing another trial of looking at tenofovir gel used around sex, before and after sex, a repeat of Caprisa 004. And unfortunately what it showed—
To see if it would prevent HIV.
To see if it would prevent HIV infection,
Yeah.
but there's also a secondary look that data will come later to talk about herpes simplex as well.
All right.
Disappointingly, it didn't show the ability to prevent HIV, and largely related to the fact that women did not use the product. What was important is this was a younger age group of women, like the other studies that have not been able to show that women were adherent to the product. And when they had women who were married and more stable, those were actually the women who were more likely to use the product. And so I think this has been a chance for us to learn a whole lot more about who are these groups of women, what is this issue? Is it younger age women? Because other studies that have had women with partners or women of older age have actually shown some adherence, although overall, because they were weighted to younger age women, you didn't see an effect in the study. So I think there's lots still to be learned, and the behavioral and social sciences work that will come out of these studies over the coming year or so will be so much more informative.
So although at one level the results were disappointing, we are learning from it and
Absolutely.
moving forward and developing new strategies and new methods to serve the health of women.
Yeah. There's one other, which is HPTN 067, and that looked at different dosing of oral tenofovir emtricitabine for PrEP in women. And in the South Africa group, they actually showed that women did take it. So I think it'll be useful for us to be able to distinguish what is it about that study that showed that women were adherent, and what are those women like, and how are they different or the same than women in some of the other studies who were not adherent.
Great, great. Gina, there was a very interesting session looking at the relationship of HIV risk and hormonal contraception for women. Can you share with our viewers what some of the headlines were from that session?
So that session was addressing some of the things people have heard in the news about Depo-Provera. It's an injectable hormonal contraception, progesterone only. It's used very commonly in sub-Saharan Africa, but it's also used commonly in communities at risk among young women in particular in the United States. You take the injection, lasts for 3 months, you get another injection. It makes it a lot easier for people in terms of being adherent to their contraception. What this session did was start to look at some of the mechanisms by which these kinds of drugs might increase the risk for HIV infection. But I think more importantly, Betsy Harold moderated the session, and she really made people in the room and the speakers think about the more nuanced discussion of women's risk for HIV, but what will happen about women's risk for pregnancy, where that may increase maternal morbidity or maternal mortality, and then also to think about the way we're able to override that risk with some of the prevention mechanisms like PrEP or potentially microbicides in the future that it's been shown in some animal studies.
Sure. So truly taking a holistic view of women's health and not just looking at one piece of it.
Exactly.
Yeah. Now, let me ask you a tough question here. What, in terms of women's health, what finding from CROI did you find to be most exciting or most encouraging?
Actually, I can't say it's a single finding. What was most exciting and most encouraging is how much there was about women and women's issues and women's health. In lots of nuanced, both basic discussions and clinical discussions that really have, these things have kept those of us who are interested in this area kind of running from room to room. And so I think the organizers need to be lauded for their ability to bring in that kind of science, but also the recognition that there is that kind of science about women's issues.
Great. Very well said. This is Ron Valdiserri signing off from CROI 2015.
For more information about the conference, visit www.croi2015.org. And for more information on federal HIV programs, visit aids.gov.